Hey guys, Eric here with Fast Slow Motion. I'm joined by Adam Morelli, one of our project leaders, as well as Erin Gibbons, the senior marketing manager for Thomas Eye Group. Erin, welcome. Adam, welcome. Erin, tell us a little bit about Thomas Eye Group.
Thomas Eye Group has been in the metro Atlanta area since 1974, so we're approaching that 50-year mark here in the community. We offer comprehensive eye care, so a full service of medical needs with our ophthalmologist, routine needs with our optometrist. We even have orthoptists in place, so routine eye care all the way to medically necessary surgery. As the senior marketing manager, I look at all parts of advertising and marketing our business. So whether that's internal communication with our staff, a new promotion we're doing for patients for the retail side of our business, any digital efforts that we have, community events. I sort of look at all of it and how it plays a part in generating revenue for our business. 2022 was a big year for Thomas Eye Group. We doubled in size. So not just the number of locations we had here in the metro Atlanta area, but also the number of doctors, which of course expanded the community that we were serving here in Atlanta. So we had a product. We were working with both Health Cloud and Marketing Cloud. It just was not working in the way that we needed it to work as we were growing so quickly. So we reached out to Fast Slow Motion in a bit of a panic because we were growing whether or not we were ready for it. And so we had the technology in place. Fast Slow Motion came in and helped make sure that the product worked in a way that was going to help us stay consistent in that growth.
So Adam, you've been project leader with Thomas Eye this entire time. Tell us about the project. How did we approach this and what did we do for these guys?
The first thing we did was we met with Erin and Ben and the team at Thomas Eye and got to understand what they wanted to do and what they expected to be working with the system. We reviewed everything and how it was working and how it wasn't working, where the issues were between the connections between Health Cloud and Marketing Cloud, as well as the connections between ModMed in this case, as well as Health Cloud. The goal of the Thomas team was to get a bunch of their market. It was marketing focused, as Erin was leading it, right? So we took that, and in order to drive all of their marketing initiatives, we had to resolve the data issues moving from ModMed to Health Cloud and get Health Cloud set up. We had our development team go in and review all the connections. We set out a plan to effectively rewire the Apex connection between ModMed and Health Cloud. Through iterating and reviewing that setup, we unlocked and removed the barriers from that connection, allowing that data to feed into Marketing Cloud and subsequently drive the targeted, segmented marketing efforts through Marketing Cloud.
Marketing Cloud, Health Cloud had been set up previously before we got engaged. Maybe the other partner didn't do it properly or didn't think things through. So Erin, I imagine just engaging a consultant, that might not have been a great experience for you. So Adam, how did we design our approach here, knowing that Erin and those guys have been burned before, we're kind of frustrated with the system. Tell us about that effort to take some time, do the planning and design, and make sure we had a solid approach.
At Fast Slow Motion, our mission is to be a blessing for our clients, right? So as our clients come to us with issues, we want to make sure that not only can we resolve them within the time frame and the budget that they have, but truly make their experience better. We want to improve their quality of their experience with their products and their systems. So we were very open. We were very upfront. We showed them, hey, these are the things that are in your way. These were not configured properly. So what we can do is we can attack them dead on, say this is what's going to be. A couple of things that we didn't do is we didn't promise that this would be a super fast fix, because we knew this was going to take time. This wasn't going to be quick and painless and flipping a switch. This was going to be some digging. This was going to require some assistance from their end to add records, edit records, review data to understand where data was incorrect from one system to another. So we were very open and upfront. We didn't promise that the marketing would be able to succeed without the solution on the health cloud end, because we wouldn't be able to drive the correct data. So the way we approached it, as we always do, is to be a blessing to our clients by being honest and delivering what we say we're going to deliver. So we broke it out. Here are the phases that we're going to go. We're going to resolve this ModMed connection. We're going to create, review the data, make sure it's brought into Marketing Cloud, make sure it's segmented in the ways that you want it to segment. And then we will kind of keep moving along in the process and eliminating barriers from that way. So the way we approach it is just to be as honest as we can and to be as direct and open with clients.
Erin, how would you describe what it's like working with FSM and working one of these projects altogether?
Yeah, he's 100% accurate in coming in, and they were brutally honest in the beginning. We wanted this to be a very quick fix because of our long experience already to get this product working well. So it was hard to hear, but I'm glad that we listened and took the appropriate steps first instead of just putting another Band-Aid and limping along with the product. Adam and his team came in, they made some recommendations. Ultimately, we decided to go, let's dig into this. Let's undo what's been done and fix it so it works well. And even though it lengthened the time of actually getting patient engagement, journeys, any sort of emails in place, I can see now, even though there's still much to be done, how that's already working so well for us, how we're already seeing patients responding to that, engaging with our business, taking advantage of the promotions that we're putting into place. So I'm glad we listened. It was tough. It was not an easy sell internally to our leadership team at all. But where we're sitting today, I would say it was well worth it. I felt like Adam and his team, they sympathized with us. They saw a product that was broken and in full transparency said, if we want to do it, we want to do it well. It's going to take some time. I would say allowing Fast Motion to come in and take the time that was needed and give us feedback based on what we had and where we could go was definitely worth the time investment that it took. Adam and his team didn't want to fail, and they wanted Thomas Eye Group to succeed. Fast Motion is by far the best implementation partner we've worked with, even outside of our Salesforce products that we're using. Great at communicating, great at sticking with their timeline, giving updates. Definitely a fantastic implementation partner.